I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here today to provide you with the COVID-19 update for Simcoe Muskoka. So as of today, we have a total of 637 cases. This is up by 25 cases since I last reported 8 days ago on July the 13th, or up by 2 cases as of yesterday. So if you look at the last day, the 2 cases that we had, both were females in their 20s, living in Simcoe County. Both are sporadic cases, not hospitalized. Both under investigation with regards to how they contracted their infection. And they're both self-isolating and both have symptoms. So if we consider the trajectory of cases over the weeks, we've had a bit of an upsurge over the past week, I would say. So from July 12th going forward for a week, we had 18 cases. One of these was associated with an institutional outbreak, which is out of jurisdiction. So the person lives here but works in an institution that's in an outbreak that's out of our area. And one is part of a workplace outbreak, which is also out of our jurisdiction. So they live here but work out of jurisdiction, and that place is in an outbreak. So 18 cases, that's up from the previous week with 7 cases. And you have to go back to the week of June the 21st when we had 40 cases to see the previous surge of cases. So we had a surge of cases the week of June the 14th and the 21st, and then a decline in cases for the 2 weeks that followed it, and now we've got a bit of a surge again over the past week, although thankfully down to 2 cases in the last day. We have no institutional outbreaks or no workplace associated outbreaks in Simcoe Muskoka. A total of 566 of our cases have recovered. That's 89% of our cases. 4 of our cases are hospitalized, with no individuals in the intensive care unit. Currently, we have 29 individuals who are recovering in home isolation and have had no additional deaths since May. We are noting that it's younger people that are being affected more recently that are the cases arising. So the average age of our cases now in the past week is 32 years old. And at the beginning of our pandemic, it was more in the range of the 40s and 50s as averages. So that's a substantial change over time and consistent with what's being seen in other health units, other jurisdictions in the province. A new pattern related to transmission through social contact or through work environment, whereas before we had that kind of thing happening, but it was also very much in senior homes, long-term care facilities. The reproductive number is 1.2. So anything above 1 means that there's presently a growth in cases in the pandemic in Simcoe Muskoka. Anything less than 1 would be a decline. So given that we've seen an increase in cases, it's not surprising that we would also see an increase in the reproductive number above 1. So some of my key messages are as follows. We're now in, as of Friday, stage 3 of the province's plan to open up the economy. Applied here in Simcoe Muskoka. Most of the province is now in stage 3. I believe it's Toronto, Peel, and Windsor-Essex that are still in stage 2, but otherwise other health units are either in stage 3 or moving to stage 3. With that, we have a lot more freedoms. There are more venues opened. We can have gatherings indoors of up to 50 people and outdoors of up to 100 people. In those gatherings, we still need to be doing physical distancing. We need to maintain a 2-meter or 6-foot setback from other people. We at all times need to be monitoring ourselves for symptoms and self-isolating and seeking assessment and testing. If we develop symptoms, we need to be doing frequent hand washing or hand sanitation. And when we are in indoor public places, we need to be wearing masks. This is now a requirement that I've made by a letter of instruction to the operators of businesses and organizations as well as transit, requiring that they have policy in place to have that happen. So this is for the avoidance or reduction of transmission. So those things are continuing to be in place, need to be in place. They're going to need to remain in place for the duration of the pandemic until we can get high herd immunity, high percentage of the population immune through vaccination, and we have to await the arrival of a vaccine before we can do that. So we have to continue all of that. And the only people that you can be close to physically would be people within your chosen social circle of up to 10 people, and it would be the same 10 people all the time, not a changing group of 10 people, but the same group of 10 people. And all of that is essential to avoid transmission. So we're now seeing evidence that people are, I think, becoming complacent about these controls. And there have been instances where people have had contact with other people. Cases that we've investigated now become more complicated through the numbers of contacts they have has gone up related to this kind of relaxation that's happening. And so the potential for transmission goes up with all of that. And if we see a little bit of a surge over the past week, we want that to be controlled and brought back down again. We don't want that to be the beginning of an upswing of cases, as has happened in other jurisdictions in the world where they've had control and then lost control. We need to keep up all of these control measures. So we do have evidence now with, I'd say there's the potential now with restaurant dining indoors and the use of bars indoors. There's a potential for transmission, and we have seen outbreaks associated with bars in other jurisdictions in the world, including Montreal, and there's now an upswing happening in Calgary. So the potential is there for us. We need to be very careful about those locations, those venues. There are still requirements to help reduce risk in those settings. So the operators are to maintain seating, which is 2 meters apart between tables. The people that are close together are to be within the same social circle. And the number of occupants in the premises has to be reduced to fit that kind of spacing arrangement to reduce the risk of contact and transmission. But to me, I think this is something we need to be very mindful of and very careful about, and we in public health need to look at what else needs to be done to protect people from transmission now that we're opening things up like that. We are also aware that people may be engaging in house parties in which there's a potential for transmission, either because people aren't physically distancing or because they have the numbers too high, that it's above the limit that the province has put in place. And that carries with it the potential for transmission, could be part of the reason why we're seeing an elevation in young people as cases. Some people feel complacent about young cases because they're less likely to be severe, but they still can be severe. We've still seen some young people requiring hospitalization or intensive care unit care, or although much more rarely than seniors, deaths can still occur. But they also can transmit the virus to people who are vulnerable, or just keep it in circulation so that we can't keep the pandemic on the downward trajectory that we want. As you know, we've also had the requirement for use of masks in place over the past week. We don't have any scientific data that would be able to be brought to bear for consideration about how well this is being complied with. We do have the impression of people that it's being complied with very well, but I don't have figures for you about that. We have received quite a few calls related to this, what I would say is that the calls are divided in terms of their intentions. So we had we have a number of different intake lines in the health unit, but I would say that one of the intake lines, we had 81 calls, which were complaint-based about mask use, but they were split between people who were opposed to wearing masks and people who were concerned about others who were not wearing masks. So we've seen a pattern there that's kind of split in two ways. We've also had individuals complaining about facilities in which there wasn't compliance with the use of masks, and same with our environmental health line. We've had some 95 calls, and they once again fall into two categories: a category of people complaining or concerned that employees of premises are not wearing masks, or people complaining that the patrons attending facilities aren't wearing masks. So quite a few calls, split between those who are opposed to wearing masks and those that are concerned about compliance with the wearing of masks. We've also heard about individuals who've witnessed or are concerned about intolerance for people not wearing masks. And I'd like to reiterate that our letter of instruction calls upon policies that would recognize when people are exempt from wearing a mask. So people who have medical conditions would be exempt from wearing a mask. Children, young children, those under the age of 2 certainly shouldn't be wearing a mask, and those under the age of 5 who can't tolerate it shouldn't be wearing a mask. And we've made exemption for people who are doing activities in which they're exerting themselves and breathing hard and perspiring. So physical activity could fall into that category, or activities that would just preclude you wearing a mask, such as swimming, would be a reason for not wearing a mask. Employees that are working behind a complete barrier, like plexiglass, would be exempt from wearing a mask if that plexiglass barrier is sufficiently protective. We've also included exemption based on religious observance as well. So in no way are the operators of these premises to ask in detail why people are exempt. They should accept if an individual indicates that they are exempt based on these criteria and not ask further about the details of it. And also we've made allowance for a best effort approach, so that an operator is not required to turn people away if they refuse to wear a mask. Although we recognize that there have been some businesses that have made it their policy to turn people away, we are not requiring that they do so. We want to avoid overt conflict situations. We want to achieve high compliance while striking a balance to avoid that kind of conflict. So one of the things I would say is I would ask that people be compassionate if they see individuals who are not wearing a mask, and assume the best, assume that they have a valid exemption for not wearing a mask, and in no way treat them in any kind of a negative fashion. And I've heard from a number of people that they've experienced that kind of thing, that they in some instances had a medical reason for not wearing a mask and yet felt discriminated against in this way. So I think it's very important that we treat each other with compassion and tolerance when it comes to this particular issue. So I've got a media question that has arisen is as follows. It appears females have a higher incidence of COVID-19 in our area. Is this a statistical anomaly, or is there a logical reason why more women have tested positive? And when we look more deeply in our data, we see that the cumulative number of all of our cases indicates that 55% of them have been women, and 45% have been men. So indeed, we do have a predominance of women overall testing positive relative to men. I would point out that more recently, in the past couple of weeks, there's been a very slight predominance of men testing positive, 52%. But if you look at the total with the women overall having more positive results than men, we see that women are more likely to be tested than men, almost twice as likely, twice the number, twice the rate per 10,000 population of women being tested versus men. And we do know that there's certain work environments and professions in which or I should just say work environments, healthcare environments, long-term care facilities, in which routine testing of the employees, the staff, has been heavily encouraged, done every 2 weeks. These are very large numbers of individuals working in long-term care facilities, and the great majority of people working in those facilities are in fact women. So I suspect that that is contributing to the difference that we see in testing, and therefore probably in the difference in the rate of cases as well. So at this point, I'd be happy to take questions.
Okay, thank you, Dr. Gardner. We'll start with Chris Simon, very advanced.
Thank you very much. Hi, Dr. Gardner.
Hello.
You've addressed part of my first question, but I'm hoping maybe you can elaborate a little bit more. So since the start of last week, so July 13th, there have been 28 confirmed by the health. 16 of those have been in Barrie, and of those 34 age category. I'm just wondering whether this is a sign of an outbreak, a pattern in a specific area, or whether this is just kind of coincidence.
So thank you for the question. I think I'll just repeat it because you broke up a bit, so I just want to make sure I got it right. So you look at the data and you see more recently we've had a predominance of cases in Barrie. Out of the 28 cases since July 13th, 16 have been from Barrie. And how do we interpret that? Is that kind of an outbreak, or what would be happening? Would that be your question?
Yes, thank you.
Okay. So we did look into that data. What we found was that half of those cases are from a single cluster, a family cluster, which did involve some travel and some of the individuals out of country. And beyond those 8, the others are not linked to each other. Some of them are community acquired. Some of them are under investigation, but there's no specific pattern that we can see.
My second question is just about public facilities opening up, obviously with the introduction of Phase 3 on Friday. Many playgrounds began to open up, but not all of them, because municipalities needed to inspect the equipment, get that stuff up to snuff. However, it does seem like in several municipalities, families are going out to playgrounds that are still closed. Do you have a comment on that? Obviously, there's a couple of issues, not just around cleaning and COVID, but potential safety hazards of equipment that hasn't been used in several months.
Thank you for the question. I wasn't actually aware of that. I could see a potential safety issue if, in fact, the municipality hasn't been able to assert that they are ready for use or need maintenance. And certainly playgrounds can be places that children get injured if equipment isn't optimally maintained. So I think I would concur that it would be best for people to wait until they're formally opened by the municipality in question.
Thank you.
Thank you, Chris. We'll go on to Erica Engel from Collingwood Today.
Hello. Hi. My question is related to modeling that the health unit has been doing. We just wondered how the current situation compares to modeling predictions for around this time?
So thank you for the question. We've done two models, one that carried us through April and into the beginning of May. And it had a very high concurrence, finding through that month with what we actually experienced. The second model that we didn't actually try to predict local cases. It looked at the province as a whole and explored our vulnerability if we were to let our guard down with regards to physical distancing or case and contact management and follow-up. And what it showed was that if we become complacent on either of those things, then we would see a surge in cases again provincially. So I'm afraid I don't have figures for you, predictive figures for Simcoe, Muskoka right now that would be comparable with our local experience.
Okay. Have there been any municipalities, I think of Bradford, for example, that have surprised you with maybe higher than expected numbers of cases or incidence rate, I guess, is a better comparator for averages?
Yeah, and I think you raised an
that have surprised you with maybe higher than expected numbers of cases or incidence rate, I guess, is a better comparator for averages?
Yeah, and I think you raised an
proximity to the south, to the Greater Toronto area, where in fact they have had much higher rates of transmission than we've had, or perhaps more urban areas such as Barrie.
Okay. Thank you, Erica. Nathan Schubert from the Moose FM.
Good afternoon, Dr. Gardner. I just wanted to ask you, because earlier you noted that you have been seeing an increase in cases in younger people. And I just wanted to ask, what can these younger people do to just take extra steps to ensure that they are being safe?
Very good question. They need to abide by the control measures that we're recommending for everybody. So we're recommending the physical distancing, except for those in your chosen social circle of 10 people and the same 10 people. Everybody in that social circle abiding by the same 10 people. And otherwise, when they're socializing or interacting with others, that they need to maintain a 2-meter distance from those people. And if they're compromised in their ability to do that, that they need to use a mask, particularly indoors, and need to be doing the hand washing, the self-monitoring, the isolation, and the testing if they develop symptoms. So they're as vulnerable as anybody else to getting this infection, and they need to abide by those practices. And even if they feel that they're not, because of their age, they're not going to be as severe, they would be at high risk of transmitting it to a loved one who is vulnerable. And so that's another really good reason why they need to abide by this.
Now, other media, more specifically referencing the United States, has put out several reports and have been reporting for quite a while that young people are less likely to become infected or really get anybody else sick. Are you worried that this mentality might have contributed to an increased rate of younger people getting infected?
I think it would be important to note that the accuracy of that would be with regards to children under the adolescent years. So adolescents, teenagers, and above have the same likelihood of getting this infection and transmitting it to others. The research that we've seen to date suggests that children are less likely to get this infection and less likely to transmit it. But for young adults, they're just as likely as anybody else. And if there's some confusion between those two groups in terms of that reality, then that possibly could be contributing to a relaxation of care.
All right, thank you.
You're welcome.
Thank you. Mike Arcelades, CTV News.
Yeah, sorry, still no video, eh? Are we abandoning ship on that one?
That's
okay,
right.
no problem. That's okay. We'll make it work. My question is, I was at bars today and restaurants, and a lot of the customers are preferring patios. Do you think that would be a wise decision right now until we get into stage 3 for a few weeks, for folks to continue as they were for the past few months, or if they really need to be on a patio to do so rather than going indoors, following up on what the OMA said on Friday?
It would be an added level of precaution to stay outdoors. We know that fresh air, good air exchange contributes to reduce risk. Sunlight acts as a disinfectant that can reduce risk. So if people want to take an added precaution, that is one thing that they can do.
With regard to these clusters, are we seeing these in workplaces, and what kind of measures have been taken since then to ensure that the spread is limited and the risk of it is limited?
We've not seen for a while workplace outbreaks here in Simcoe, Muskoka. The potential is certainly there. Certainly as we open up the economy, the potential is there. We've been doing a lot of outreach, receiving a lot of calls with questions about how businesses can operate in phase 3. Our requirement with mask and face covering use is meant to be an added precaution. But at this point in time, we don't have any known clusters or outbreaks associated with the workplace here in Simcoe, Muskoka. I have cited that we have one individual who lives here and is part of a workplace outbreak out of district, and one individual is part of a healthcare institution outbreak out of district. But we don't have any known at this time.
Okay. Thank you very much for your time today.
You're welcome.
Okay, we'll go on to Ian McLennan, Barrie 360.
Dr. Gardner, Premier Ford didn't specify when asked today about how bad things would need to get for the province to roll back on reopening from the stage 3 to stage 2. Just curious, your perspective on that. Would you favor a complete, roll back to stage 2, or would you prefer maybe targeted, where we've seen in South Korea, Montreal, where it's been a specific bar or institution, as opposed to a carte blanche rollback?
I think we would take a graduated approach using our data to guide us as to what needs to be done, and certainly start with outbreaks that are happening within a work environment or certain work environments or certain healthcare facilities. We would take that approach. And if, in fact, things became widespread, multiple health units, multiple venues, it would really be up to the province to determine whether or not they needed to do something more specific or drastic with regards to a rollback of some of the control measures that they've freed up.
Okay, that's it. Thank you very much.
You're welcome.
Thank you. We'll move on to James Bowler from your TV. Are you still with us, James? Okay, Elizabeth Smith from Rogers.
Yes, thank you so much. Dr. Gardner, my question today is about, I'm not sure if you heard about this group called the Long Haulers. what they're saying is their symptoms last longer than the 2-week period. I'm just wondering if you have any thoughts on that group of people.
I've read of them for sure. I've seen a letter from them to the federal government listing, itemizing their own stories, their own symptoms, asking for more research to be done about their condition, that they certainly want to be taken seriously as to their ongoing health issues that they relate back to their initial infection. I would say that we need to be open to that kind of thing because this is a new disease and we're learning more on it every day and need to continue to learn about it. If there are, in fact, individuals that have chronic symptoms related to this, we need to understand that and to treat them with compassion and hopefully down the road identify ways to help them with their symptoms.
Thank you. And my next question is specifically about masks. There seems to be a lot of confusion out there in the community about why we wear masks and who they're protecting, if they're protecting the mask wearer or if they're protecting other people around them. Can you just clarify that for us?
Happy to. So with a cloth mask or face covering, you're wearing it to protect others around you. There's no evidence that it protects you because they're too permeable for that. But they do reduce the spread of droplets from the wearer, the kinds of droplets that get exhaled and can carry COVID-19 and cause infection in others. So the protection is for those around you, and therefore if everybody is wearing a mask, we all become protected that way, and it helps reduce the general level of transmission in the community and helps to prevent a resurgence of cases or loss of control of the pandemic.
Excellent. Thank you for that clarification.
You're welcome.
All right. Is there anyone on the line who has not had a chance to ask Dr. Gardner questions?
Dawn here from Huntsville Doppler.
Oh, Dawn, if you'd like to ask a question, go ahead.
Thank you. Hi, Dr. Gardner.
Hello.
My question is regarding how well we're positioned to deal with future cases in Simcoe, Muskoka. I mean, clearly the healthcare system spent a lot of time ramping up, but now that things have settled a bit, should we see a surge in cases, how well are we positioned to respond to those right now?
There's a lot of work going into that, being done through the leadership of Ontario Health, the Central Region for Ontario Health, through them, local hospitals and other healthcare providing agencies, being prepared for the next wave while also at this point recovering from the loss of care that they were able to provide. So they had to put on hold a great deal of the care, the routine surgeries and procedures that they normally do had to be put on hold, and now they're getting that back up and running. And there's a lot of discussion around how to continue that even if you end up with a resurgence of COVID-19 again. And part of the response to that would be the kind of field hospitals that have been constructed. So RVH, for example, has its pandemic response unit, a large tent structure in its parking lot, and it's for that purpose of being able to take a surge of cases and hopefully be able to maintain their healthcare services through a surge. For us in public health, we, of course, would need to be able to do our part in all that we do. So the case and contact management that we do to prevent spread from cases to other individuals, and the public messaging that we do, supporting people's efforts to maintain physical distancing, the kind of direction that I provide, such as the requirement to use a facial covering in indoor public spaces. All of that would have to continue we'd have to be able to ramp up all of that, and if and when we get a resurgence, a second wave. We had to employ all of our staff, or almost all of our staff, with the first wave. We're now moving staff where we can back to their other programs so that they can do everything else that we do. But if we get another wave, we'll have to redeploy them back again for the response to COVID-19. So our main capacity for response will be the redeployment of the staff that we've presently got back to their old work.
Okay, thank you for that. And my second question relates to the skeptics out there. We're seeing comments from people who are questioning the need for masks because they weren't asked to wear them early on. There are people who are looking at the changing situation because as we learn more about this virus, more information comes out and perhaps contradicts what was known previously. So how would you respond to, or maybe a better question is, what do you think is the best way to convince people who are skeptical about the science that's coming out that it is something that they need to pay attention to, even if it contradicts what they've heard before?
So I certainly would invite people to have a look at the resources that we have on our website and to contact us. We've got our staff deployed to receive phone calls, to respond to emails, to give information. The science is evolving on this. Earlier on, we didn't have as much research about the effectiveness of masks. What has come out is comparative analyses looking at countries that have used masks and face coverings early on compared with those that did not. This showed quite a marked difference in how well they did. That's forming, I think, very much the basis of our action at this time. So had we known early on that evidence would come forward, we could have used it and made that decision earlier on and decided to use masks earlier on. We're now acting on what we know, acting on the evidence that we have. And some of the research, mathematical modeling suggests that, in fact, the use of masks is most effective if done early rather than waiting until you have a high degree of transmission happening, a large number of cases happening. So that would be support for acting now in a preventive way to avoid a resurgence. We also know that resurgence happens. We've seen it happen in a number of countries now, very much in the southern United States. And to a very much higher degree than we ever experienced here. We certainly don't want that to happen here. So we feel it's prudent to act now with this precautionary measure of using masks to prevent that from happening to us. Nobody wants to go back into a lockdown situation. We want to maintain the gains that we've had and the freedoms that we've had. I would encourage people to have a look at the information that we have, to contact us. We will certainly continue to monitor the scientific evidence as it comes out as well.
Thank you.
You're welcome.
All right. Does anyone else have a question for Dr. Gardner before we wrap up?
Mike from CTV, can I jump right in there once more?
Certainly.
Doctor, with regard to beaches, we've had a lot of folks complaining about overcrowding and folks from the city in particular coming up. Have you had any consultations with the city of Barrie in particular about the possibility of type of enforcement or some type of restriction of people from the GTA coming up here? Is that a real threat, and has any consultation happened?
We've had ongoing discussions with the municipalities several weeks on this topic. Back at the beginning of June, we issued recommendations for the safer management of beaches and other public outdoor settings to reduce transmission, reduce crowding that could lead to transmission. It's proven to be a real challenge for municipalities. Some of the ideas that we had really came down to reducing the numbers of people on beaches, reducing the access points, and controlling the numbers as they come in and allowing people in as others leave, and otherwise encouraging them through various means to space apart and not come close to other groups. What we've heard back is that in practice that's been difficult to do, that most beaches have multiple access points, so it's very hard to control people coming and going onto the beach, that they put in place measures, some of them such as reducing the amount of parking that's available or charging parking for those that are from out of district as a way of reducing the number of people that are on the beach, and having park ambassadors on the beach that would patrol the beach and encourage people to separate from other groups to maintain spacing. But it remains an ongoing challenge.
So when the mayor Barry recommends that he might possibly be closing a beach because of numbers, you would support that in terms of, in the name of public safety and health and safety of the public here, in particular in Simcoe, Muskoka?
I would say that if the municipality feels that that is necessary, that their other measures haven't worked, that is their prerogative, and I would support them.
Thank you.
Okay. Thank you, everyone. I think that's the end of our media briefing for today, and we will see you all again next week. Thank you, Gardner.
Yeah, thank you. Goodbye, everybody. Sorry about the video. We'll correct it for the next time.
Thank you.
Bye.
Thank you.